Hey, welcome to my channel. Today I'm going to show you how to get relief from pain in your feet caused by neuropathy. So what is neuropathic foot pain? Well, it's pain that's caused when there is a change in the nerves to your feet. This can usually happen when there is damage to the peripheral nerves. For example, if the circulation to the extremities isn't what it should be, remember that your feet are the furthest thing away from your heart, this will damage the nerves. And this can be caused by many different factors. Now, common causes are things like diabetes and metabolic syndrome. These can be managed by your doctor and helped by lifestyle changes. Autoimmune diseases can also cause it. Again, these can be managed by your doctor and lifestyle modifications. Alcohol abuse, certain medications, low vitamins or vitamins, all these things can cause damage to the nerves. Now, if you don't know why you have foot pain, I would suggest getting a professional to give you a diagnosis, and then when you're managing it, either with medications or a lifestyle perspective, then do these exercises. Now, the aim of these exercises is to stimulate the blood flow to your feet and help the nerves recover. The first thing I want you to do is to take a tennis ball or some sort of ball that you can roll underneath your foot. And we're going to put a little bit of light pressure on here and start to find areas where they might feel a bit tighter, maybe even a bit more painful, and slowly massage into the area of your foot. We want to cover the whole bottom of the foot because we're going to loosen up the fascia and the skin and the connective tissue here to help the blood permeate into those peripheral nerves. Now, the reason we're sitting down and doing this and not putting our full body weight on is that sometimes with peripheral nerve problems, you can actually get a little bit of numbness in there as well, and it's easy to put too much pressure in and potentially end up damaging the foot. So you need to be aware of that. If you feel numbness, take it easy and don't overdo this. So you're going to work the whole length of the foot from the heel, working around in tiny small circles around the heel, down the side of the foot, the inside arch of the foot, across the ball of the foot, and even try and get a stretch and some movement into the individual toes as well. There's a number of different ways you can do that. You can do that like this, where you spread the toes around the ball, or you simply just push the toes down into the ball, trying to get a little bit more pressure than your foot normally gets, especially if you're wearing tight shoes. Personally, I try and wear Vivo barefoot shoes, which have been shown to strengthen your feet in a short number of months. Just 3 or 4 months can strengthen your foot significantly, and they also allow your foot to move in the way it's designed to move, with all 26 bones moving in concert with each other. All right, once you've done that to both feet and you've started loosening up the fascia, we're going to start getting into some specific strength exercises. Now we're going to improve the coordination to our feet using specific toe exercises. Okay, so for this one you can be standing, you can hold onto a chair, whatever you need to do to make yourself feel comfortable. What I want you to do here is to try and lift up your toes. Okay, so just lifting them up, so from the side, simply looks like that. Now, rather than putting them straight back down again, I want to see if you can put them down one by one. So you're going to start with the outside of your toes and then slowly go down, trying to make your foot as wide as possible. So do that again. You're going to lift up and go down toe by toe. Now, initially when you do this, it might be frustrating that you can't control the movement of the toes individually, because we've put our feet in shoes most of our lives and we haven't really ever used the toes individually, but they do have that capability, and with practice it gets easier. So that's going from the little toe down to the big toe. Now we're going to go the other way, big toes down to the other toes, and I struggle with this one a little bit. So big toes can go down, and then you're going to try and put the other toes down individually. But for me, for some reason, I can go little toe to middle toe, but not middle toe to little toe. Something I need to work on. But working on the actual individual control of your feet is very important. So this is another exercise as well. You can go from big toe to little toe, to big toe to little toe. And you'll feel the intrinsic foot muscles working, and they also require blood, and so there'll be more blood pumping down to the feet, and they also require a lot of neural, which is nerve control, in order to do this. So do this about 3 to 4 minutes, trying to get some really nice coordination back into your feet. Now we're going to work on the actual calf and front shin bone muscles here. We want to get these things working, we want to get the mind connected back to them to start helping the nerves and the blood flow. All right, so you're going to lie on your back, put your hands around your leg here. You can have a pillow behind your head if you want, or you can hold your head up. You're simply going to move your foot up and down like this. And you might think, well, this is a bit easy, but for some people this can be quite challenging. But we're really going to work on getting the ankle moving again and the toes pointing. You see my toes are moving as well? Get your toes pointing down and get your toes pointing up. And this ankle movement is what we need when we're walking to get the calf pump working. The calf pump is the movement of the blood back up from the feet towards the heart. So I want you to do this until you start feeling these muscles working. And it won't be long, maybe 10, 20, 30 reps. And then you'll get a muscle working sensation, maybe a slight burn in the front of your legs and maybe in the back of your calf as well. Once you feel that, relax and then go to the other side. Do this both sides around 3 sets of 20 to 30 reps. Get that ankle moving again. Once you've got your ankles moving lying on your back, you can then actually do that sitting and then eventually standing. So this one's going to be pretty straightforward. It's the same exercise. You're going to rock from your heels to your toes, trying to get as much movement and bend into your toe here as possible. And that's going to start getting the muscles stimulated in a slightly different way to what we were doing lying on our backs, which is then going to help the blood get pumping up and down into the legs. So this one, you can do these at the same time. Again, sets of 20 to 30, going through about 3 sets. The last exercise I want to show you here brings it all together. We're going to be using your body weight to stimulate the calves. So I want you to find a step in your house, or if you can't find a step, just something that you can actually lift up and down from, like a mat or some sort of lift. So I'm putting my hand against the wall here for some stability. I'm taking my heels off the edge of this step in the patio, and I'm simply going to go up and down. Now this is more challenging, and so we might not want to do as many reps as we did before, so maybe 10 repetitions, maybe 2 to 3 sets of this one. But the calf and the muscles in the back of the leg here, they work in lots of different ways, so we want to do the exercises with the feet turned out, and we want to do the exercises with the feet turned in. So we're going to turn the feet outwards, go through our sets and reps here, and turn the feet inwards. This is going to be great to get mobility into the toes, mobility into the ankles, and strength into the calf. And it's going to pump the blood through there. It's going to help really sort of stimulate the nerves, and it's going to help you manage your foot neuropathic pain. If you've enjoyed this video, please support the channel by giving us a like, leave a comment or a question, and subscribe. Also click on that notification bell and feel free to send this video to a friend who you think will benefit from this content as well. Now also, you may know that I help people recover from illness and injury using a combination of specific exercises and lifestyle medicine. If you want to use changes in your lifestyle to make changes in your health, email me at ed@edpadgett.com and we can set up a call to see how you can make your lifestyle your medicine. Stay tuned for my next video, which will be up soon.